Heather. Good afternoon, and thanks to everyone for joining us today. Today we have Dr. Morrison here, and also Marion Dowling, our Chief of Nursing for Health PEI, is with us online. PEI has seen an increase in the number of cases in the last 10 days of COVID in Prince Edward Island. Most are all associated with the new Omicron variant, which we are coming to know to be highly transmittable. However, as Dr. Morrison will speak to in a few moments, we are seeing, for the most part, mild and moderate symptoms for those who are vaccinated and contract the virus, which is a positive sign. Most cases to date are reporting mild and moderate symptoms such as congestion, cough, sore throat, and fatigue, which we know proves that the vaccine is doing what it should be doing and protecting us from serious illness. Dr. Morrison has also talked a lot about this being a time of transition. And part of that transition will be talking about more perhaps about the severity of cases and the overall health impacts as opposed to just the case level in general. But I'll allow Dr. Morrison to talk more about that in a moment. Just with some of that in mind, one of the impacts that we are most likely to see in the coming days and weeks may not just be in the form of hospitalizations, but in absenteeism. As more people test positive and as well as their close contacts needing to isolate to do their part to stop the spread of the virus, we're going to see some absenteeism around all parts of Prince Edward Island, and that's something we're trying to get prepared for and to be ready to address, and to assure that essential services are maintained in our province. We have activated an integrated response team made up of senior officials from CPHO, Health PEI, and other government departments to ensure that government programs and services are not disrupted over the coming weeks, days, and months. This planning includes prioritizing essential services such as programs to vulnerable islanders, ensuring payments and support programs are administered without interruption, all the while ensuring that the safety and well-being of both islanders and our public service are maintained as we continue to offer these important services. We have asked each department to renew and enact their business continuity plans in the last few days, as well as to identify staff who could be redeployed to essential service areas across government so that we can maintain these services for islanders. As well, all government employees who can are and will continue to work from home to limit the spread inside of government and beyond. At this time, no essential services have been impacted. The majority of public services being asked to work from home, as I said, where possible, and where in-person work is required, the same measures we've had in place at the beginning of this pandemic and throughout are being asked to continue to be emphasized, that being the cohorting of staff, maintaining physical distance, and mandatory masking in workplaces and public spaces. Earlier this week, we had to make some necessary changes to our testing procedures and protocols, similar to what we've seen with every jurisdiction across the country. Right now, our clinics are limited to testing in three main categories: individuals who have symptoms of COVID-19, individuals who are close contacts of a positive case, and individuals who have tested positive on a rapid test. These changes will allow us to target our testing to those who need to be tested. I want to reiterate the importance and need of getting tested if you have any, and I mean any, symptoms of COVID-19. I want to touch for a moment as well on rapid tests. The rapid tests are being distributed at our points of entry, at our testing clinics, and at Access PEI centers in the province where testing clinics are not available in their communities. PEI has been using rapid tests for months at our points of entry, mostly the ID Now rapid tests, but also at vulnerable settings such as long-term care, congregate living settings, schools, jails, all of those settings that are vulnerable in the face of outbreaks. We have made these tests readily available in the past number of days based on the level of transmission in our province. We will continue to do this targeted approach. We have confirmed that the Government of Canada will provide approximately 300,000 additional tests, rapid test kits in January. But as a provincial government, we have also been working to secure another $300,000 for the month of January through private suppliers. We have also engaged other government employees to provide assistance and support and help answer some questions and assistance with public health as it pertains to contact tracing. Almost 80% of the cases in PEI are either related to travel or are close contacts. So the longer we can maintain appropriate contact tracing, the quicker we feel we'll be able to curb the spread of COVID-19. So it's an all hands on deck approach to try to assist public health in any way we can. Expanded vaccine clinics as well is something I'd just like to touch on briefly. Vaccines have helped shield us from the most severe outcomes of this virus, and we know that will need to continue. I know Marion is on the line, and she will talk a little bit more about our mass vaccination clinics, but they are being started up in the coming days. They will be in Summerside and Charlottetown as before. The mass clinics and pop-up clinics will be key to keeping our population safe, and I encourage all of those to book for their booster or for their other vaccines if they haven't had those yet, because vaccines have really helped us to this point. They've helped stave off serious illness, and we need that to continue. I also want to thank Minister Lawrence MacAulay and our federal colleagues at the Department of Veterans Affairs, who have distributed a notice to registered nurses with their department on PEI to offer assistance in expediting the rollout of booster shots by volunteering to assist at our mass clinics. This is so much appreciated, and I'd like to thank those who have already offered their help with their booster rollout, and we expect those numbers to increase in the days ahead. Also, just want to talk briefly about the government response and our programming. Since the beginning of this pandemic, we have consistently said that our government will be there for Islanders to do what we can for as long as we can and to support them through these very challenging times. Over the last few days, Cabinet has met and approved a variety of programs and support services to assist Islanders. These programs include, but aren't certainly limited to, reinstating the $500 emergency payment for impacted workers. This program will be retroactive to December 27th and will provide those who have seen a 25% or greater reduction in their income a one-time payment of $500. Application for this program will be open immediately today online. The program provides immediate relief for those impacted while they may await benefits from other programs that we can mention a little later. Islanders who are not able to work for less than 50% of their scheduled shifts because they're sick, because they may be self-isolating or awaiting test results, will be eligible to be paid through their employer through the COVID-19 Special Leave Fund. This fund is active now and can be accessed immediately through your employer. That's reigniting a program that we had earlier in the pandemic. Islanders who are not able to go to work for more than 50% of their scheduled shifts are eligible for federal programs such as the Canada Recovery Sickness Benefit, the Canada Recovery Caregiver Benefit, and the Canada Worker Lockdown Benefit. For those individuals who do not qualify for the Canadian Worker Lockdown Benefit, for example, because they do not fit into certain parts of the criteria, who may be self-employed, for example, the Department of Economic Growth, Tourism and Culture will be launching the Emergency Income Relief Program, which will provide $300 per week for those impacted by the reduction of income. For those who qualify for any programs that I just listed, it is also important to note that they can still qualify for the one-time emergency payment of $500 to provide immediate support. For those who are self-isolating, staying home because they have symptoms, who might need assistance with food or other essentials, the Department of Social Development and Housing has established a partnership with 211 to provide support to these individuals while they are isolating. Anyone who needs assistance with essentials such as groceries, the dropping off of supplies, home heating assistance, or anything at all can call 211 and they will be connected with the appropriate officials to provide these supports. In addition, the Department of Education and Lifelong Learning and the Department of Social Development and Housing have worked collaboratively to provide children across the province with a modified school lunch program. school food lunch program next week while children are at home. Registrations will open today, and there will be 2 deliveries made to participants' homes next week. Each delivery will provide 3 meals for those registered, and more details will be released this afternoon. And all of these programs will be live and online in the very short time ahead today. I know this is a lot of information in a short time, but this information, as I say, will be available online, and we feel it's important for Islanders to know that we're trying to do as much as we can, as fast as we can, to help those who might be impacted. In closing, I want to again say that I reiterate that although we are seeing high numbers of cases, because of that high uptake of our vaccine, our province is seeing mild illness with the cases thus far for the vast majority, and that is a good sign. That will need to continue. We will need to continue in the coming days and weeks within our communities to do what we need to be doing to limit the transmission of these diseases. This isn't the time for large gatherings, as we've talked about for a while. And what we do over these next few weeks will allow us to move perhaps a little bit more quickly to make our way through this as we learn to live with COVID and deal with the challenges of this Omicron variant. So, Dr. Morrison, I know I've said more than I normally do, but I will now turn it over to you for your comments and the most up-to-date information on COVID, and then we'll go to Marion.
Thank you, Premier. Good afternoon, and thank you for joining us here on this second last day of 2021. The last week has been marked by Christmas and holiday festivities for some, and COVID-19 testing and isolation for other individuals and families. The pandemic and the aggressive Omicron variant is resulting in an unusual season for everyone here in PEI. While we did not plan to be dealing with a crushing Omicron wave at this time, it will mean we do transition, and deliberately so, towards our journey to living normally with COVID-19, where we do move from a pandemic to an endemic state, meaning that there will be, at some point, stable transmission of this virus. And this will be something we do step by step. As of 8 a.m. this morning, there are 169 new cases of COVID-19 to report, bringing our total active cases to 680 and 1,191 since the pandemic began. In the last 7 days, we've had over 600 new cases of COVID-19, an average of 86 new cases per day. We have reported over 50% of our total cases in the last week. There are 3 people in hospital being treated for COVID-19. 2 individuals are between the ages of 60 and 79 years, and 1 is over 80 years of age. There is no one in intensive care. I will note there are 5 additional people who are in hospital for other reasons who do have COVID. This is the highest number of daily cases and active cases we have experienced since the beginning of the pandemic. Fortunately, the majority of individuals, as the Premier mentioned, have mild to moderate symptoms and are not seriously ill. And I think we're hearing this across the country, the real need to focus on severe outcomes, our hospitalizations, our ICU admissions and deaths. And although it is still early days and we continue to learn about the impacts of Omicron, we are doing many things right. It does appear that our high rate of vaccine and our public health measures are putting us in good stead and providing important layers of protection against serious illness. Of the cases announced in the last week, the majority were close contacts of positive cases or travel-related. But about 20% of cases did not know where they had acquired COVID-19, and this represents community spread. We've had questions regarding the geographic distribution of cases in PEI, and there are positive cases in all areas of the province. There's no area of PEI untouched by this wave of the pandemic. As of today, we are still on an upward trajectory and are keeping a close eye on the number of cases, but also the rates of severe disease and hospitalizations among our cases. We are seeing considerable transmission in households. It is not unusual for entire households to test positive. A number of cases are linked to gatherings and workplaces, highlighting the importance, to the extent possible, of wearing a mask and maintaining 6 feet physical distance from people outside your household when in social settings and when at work. As we announced publicly earlier, we are no longer able to identify and report public exposure locations. This decision was based on the need to focus public health resources on contacting cases and case management. Given the amount of transmission and the significant infectious pressure in the province, I urge all island residents and visitors to assume that every public venue and event is a potential exposure location. We should assume the person next to us has COVID-19 and protect ourselves by wearing a good quality 3-layer mask properly, maintaining 6 feet of physical distance, washing our hands often, and staying home if we are not feeling well. In PEI, our public health resources are strained under the pressure of this wave. We've had to make further adjustments in how we conduct contact tracing and manage cases of COVID-19. Public health staff in PEI continue to call positive cases to discuss the isolation requirements and answer questions. In turn, positive cases are asked to reach out to their close contacts and share prepared information by email explaining the testing and isolation requirements. Public health will continue to focus on high-risk settings, congregate living settings in terms of follow-up. I do want to just review the isolation and testing requirements for positive cases and close contacts. Positive cases at this time are required to isolate for 10 days. And this is from either the date of symptom onset or the date of the test. As I just mentioned, cases are being asked to identify their close contacts. And a close contact is someone who you've had face-to-face contact with, where masks by either person or by both were not worn for at least 10 minutes during their infectious period. And that infectious period is 2 days before the onset of symptoms as well. And the close contacts would include family, friends, co-workers, and others such as people you at personal or organized gatherings with whom you've had that close contact with. Close contacts are required to get tested on days 0, 6, and 9. Those who are fully vaccinated are required to self-isolate for 7 days from the date of the last exposure. Those close contacts who are not fully vaccinated are required to self-isolate for 10 days from the date of the last exposure. If people have questions about isolation or testing requirements, they can call 1-800-958-6400. Now, I will note that similar to the rest of the country and other provinces, we are looking at decreasing that isolation period for both cases and close contacts and looking at the evidence around doing so. We know the Omicron variant is more transmissible than other variants. The sharp rise in cases in PEI, which is not unexpected, but certainly speaks to the ease and speed at which Omicron is transmitted. The experience, for instance, in Ontario suggests that Omicron infects 4.5 times more people than each case of Delta, with cases doubling every 2 to 3 days. Given the high degree of transmissibility of Omicron, our public health measures are vital to slowing down the spread of this variant. The majority of people with Omicron have symptoms compared to other variants. And the most common symptoms, and the Premier mentioned some of these, are respiratory, including cough, runny nose, sore throat, and many others having a headache, fever, chills, and general weakness. And the majority of people with COVID-19 have mild to moderate symptoms. Early data suggests that vaccine effectiveness against Omicron infection and symptomatic disease after 2 doses of vaccine is lower. However, it is higher after receiving a booster dose. Being fully vaccinated does provide protection against hospitalization and severe disease, and you have better protection after receiving the booster. With Omicron, being fully vaccinated and receiving your third dose or booster dose is more important than ever before. And I know Chief of Nursing Marion Dowling will be discussing the availability of vaccine appointments and Health PI's plans to increase access for PI residents who are eligible for their booster. In the province, there are over 5,000 people in self-isolation as cases or close contacts. And the requirement to isolate for 7 to 10 days is an unexpected burden. But isolation is key in limiting the spread of COVID-19. So thank you to the many individuals and families who are isolating. Thank you for caring about your health and the health of others. We know that COVID-19 related isolation is affecting some businesses and organizations where outbreaks and community transmission are resulting in employees being in isolation and unable to attend work. This is making it very challenging for some employers to maintain services. And this wave of the pandemic is causing significant disruption in the province from tip to tip. In workplaces that provide essential services that are experiencing an outbreak of COVID-19, we will be implementing a test to stay policy to allow essential workers who are close contacts and asymptomatic to undergo regular testing and continue working. The daily testing regimen is either PCR or ID Now, which are both molecular-based testing, as well as rapid antigen tests. When they are not at work, they are to be in isolation. This policy is not without risk and will be used sparingly. In situations where there's a declared outbreak in a workplace that provides essential services, that is the main focus, and I know Health PI has spoken about using it with frontline healthcare workers. It is not intended for situations where there are single cases that are not linked to workplace transmission. Approval from the office is required in order for an employer to implement this policy. This policy aimed at supporting the provision of essential services in PI requires changes to the legal order to allow individuals who are close contacts of a case to do essential work, provided they follow a testing regimen and specific public health measures. There will be information available on the website by the beginning of next week, including the process for employers to request approval to participate in the test to stay policy. As of Wednesday, December 29th, 95.4% of island residents aged 12 and over have received at least one dose of vaccine, and 92.2% are fully vaccinated with 2 doses. The vaccine rollout for children aged 5 to 11 is going well, with 41.9% of children in this age group having received their first dose. Over 18,000 people have received a third dose or COVID-19 booster. And it's encouraging to know the total number of doses administered each week has been increasing in the last number of weeks. Thank you to the staff at the vaccine clinics and community pharmacists who have been working to add more clinic appointments to increasing access to third doses. People should book their booster appointments for 6 months after their last dose. And getting a booster, as we've mentioned, is an important layer of protection against serious illness related to the Omicron variant. Vaccine appointments can be booked online or by calling the vaccine booking line or with a pharmacy, and I know Marion will be speaking about more details. And again, the Premier mentioned this as well and touched on this. In order to preserve the limited capacity of Health PI testing clinics until further notice, testing will be limited to symptomatic individuals, close contacts of a positive case, confirmatory tests for individuals who test preliminary positive with a rapid antigen test, as well as confirmatory tests for individuals who test preliminary positive at the point of entry. Individuals who do not have symptoms and who are presenting for testing related to travel at day 4, for instance, will be provided with home rapid antigen tests, 2 tests to be taken 48 hours apart. And I may pause it for 1 second to just, we've talking a lot about testing, and there are PCR-based tests, there are ID Now molecular-based tests, which are rapid tests, but they are different than the rapid antigen tests that we're hearing about. So there's a lot of different tests to talk about. And they all have their own Some are more diagnostic versus screening. They all have their own sensitivity and specificity, and so they're not all exactly the same. And they're influenced by different factors, including the prevalence of COVID in the community. So basically, depending on the prevalence in the community, we have different confidence levels in terms of making sure that's a true positive test. And maybe at a different briefing, we can talk more about those different types of tests. But in terms of the rapid antigen tests, we have a limited supply, and then we'll continue to distribute them in a targeted manner that's focused on screening frontline staff who are not fully vaccinated and work in high-risk areas, screening individuals who are traveling to PI and who cannot be tested at the points of entry, supporting children to return to in-class learning when there have been cases and outbreaks in schools, and providing access in areas of the province where there's limited access to health PI testing clinics. We'll continue to keep a reserve of rapid screening tests to support the provision of essential services, including healthcare, in the event of a large number of frontline staff who are identified as close contacts. And we continue to work with the Government of Canada to secure additional home-based screening antigen tests. Omicron is a different part of the pandemic, and Omicron is going to force us to do things a little differently. It is not only a different variant, but it's going to make us do things differently here. The last few weeks have been very challenging for everyone in PI. It is discouraging, but not unexpected, that Omicron cases continue to rise so quickly, despite our efforts to limit our contacts and follow public health measures. And many of these measures that we put into place from a public health point of view only went into place a week ago. So again, we will often see that it takes time for those measures to work. It is difficult to know that many of our family members, friends, and acquaintances are affected by COVID-19. And the last few weeks have been challenging for individuals who work in all areas of the healthcare system, including the testing clinics, the provincial laboratory, public health, acute care, island EMS, and border screening, to name a few. Individuals have worked tirelessly to support our collective efforts to manage and contain this wave of the pandemic. I know that 2021 Christmas break was very short for many of these individuals. We have tools to protect ourselves, and we know what they are. Sticking to the basics of hand washing, getting tested and isolating if you have symptoms, wearing a well-fitted 3-layer mask properly, staying home when ill, maintaining physical distancing from people outside your household, and keeping your circle of contacts small, sticking to that steady and constant 10 people. And when you can, keep it even smaller and keep that group consistent. Making sure you get vaccinated, and everyone eligible should receive their booster dose, and getting a booster is very important. With 2022 upon us, I ask all Islanders to keep New Year's celebrations as small as possible and within the guidance. I am confident that the 2022 holiday season will be different than what we are experiencing this year. And I've said to some of our team, this will be our last pandemic holiday. So let us continue to draw on our resilience, good nature, caring, and compassion as we manage our way through this wave driven by the Omicron variant. I think we will slowly march down the road out of this pandemic to an endemic state, and we will have adjustments along the way. But as we march, some may want to go at different speeds, and we'll have different comfort levels along that road. But this, and I know the Premier and I have spoken about that before we came down. This next couple of weeks, next few weeks, will be maybe a difficult march, but we will get there. So more than ever, let us continue to be patient and kind.
Thank you, Dr. Morrison. Appreciate that. Yeah, we have Marion Dowling, the Chief of Nursing for Health PEI, is on the line. And assuming you can hear us, Marion, I'll turn it over to you.
Thank you, Premier. Good afternoon, everyone. I just want to start by offering my thanks and recognizing all PEI healthcare workers, including those at the Chief Public Health Office, who've been working hard to test, contact, trace, vaccinate, and care for people with COVID-19 and their families. Your skills, knowledge, and professionalism have helped us slow the spread and reduce the impact of cases while we ready ourselves for more hospitalization that we know we can expect. Keeping our staff is a priority for Health PEI, and in order to care for Islanders, our teams need to be able to work and be supported. While we aren't seeing COVID cases spread rapidly in hospitals, we know it is spreading in the community, and our staff, like many others, are close contacts of cases or even COVID positive. Working while being a close contact allows us to keep our health services open, and Islanders rely on us for that. We're happy to be supported by the Chief Public Health Office in our new policy to allow staff who are close contacts to work while isolating, following stringent testing and personal protective equipment protocols. Because testing is such an important part of this strategy, beginning today, we are providing healthcare workers who need to be tested before their shift as part of their scheduled testing for isolation with priority access to testing. They will have identification that allows them to be tested quicker at our testing clinics. This quick access to testing for our healthcare workers is in place to ensure that these workers can be on the front lines, providing care for you and the people you love during this pandemic. We appreciate the public support for our healthcare workers for following these protocols to be tested in order to come to work and provide care. We continue to test high volumes of people at our Health PEI testing clinics, and as Dr. Morrison mentioned, have moved to those on-site molecular-based tests. Just to note that people will still receive their negative results online when using this form of tests at our clinics. The shift in testing does preserve our limited laboratory capacity while maintaining access to testing for those who need it. We're also revising our pandemic response plan for our health system to better suit the anticipated way Omicron will spread and affect people. This includes looking at our whole system as to access and where capacity is, and assessing how we can maintain as many services as possible while we continue to have more cases and more staff affected. Our intention is to only reduce services when absolutely necessary, as we know all our healthcare services are critical for Islanders. However, as we see the impact of the surge in COVID cases is felt more and more, we can expect that some reduction in health services will occur. Any changes to our health services will be clearly communicated as they happen. And both the Premier and Dr. Morrison spoke about vaccinations, and our response team is also focusing on rolling out more and more vaccinations for people, particularly those who are eligible for their third dose booster, and for children aged 5 to 11 who are getting their first doses. We do have appointment-based clinics at the Sherwood Business Center in Charlottetown this week and carrying on throughout the weekend. And I know we have availability in those clinics in the coming days. They can be booked right now through a website, which is chlschedulingpei.as.me, and it is available on the website where you can link to our other bookings, both Skip the Waiting Room and through the local pharmacies. We hope to integrate these clinics soon within our Skip the Waiting Room booking system to make it easier for people. But I do want to promote those clinics that will be available to everyone throughout the weekend and the coming days to access your third dose boosters. We are finalizing plans for more vaccination clinics for larger groups of people, and we will be moving back to the Eastlink Center in Charlottetown, as well as into some expanded space at the County Fair Mall in Summerside. And I want to offer my thanks to those businesses who've been very supportive and allowing us to work with them to expand our clinic access. We plan to have these up and running in the second week of January and expect to start having some additional appointments available for those clinics by next week. Pharmacies continue to offer vaccines across the province. On behalf of Health PEI, I wish to thank them for increasing their access and providing such an important service to Islanders alongside us. I also just want to reassure Islanders that our hospital and health centers are safe for people to attend your appointments and receive care. We use all the required masks, personal protective equipment, and public health protocols to ensure the risk of spread is minimized. Most spread of COVID-19 is seen in the community and through travel, as Dr. Morrison noted, and our services are safe. Please come and seek care if you need it. Because of that current risk of community transmission, we have adjusted our visitor protocols in our hospitals and long-term care homes. All patients and residents can continue to have up to 3 designated partners in care to support them, but regular visiting is not permitted at this time. Masks are required in our healthcare facilities, both for staff and partners in care, and eating and drinking of the public while attending to a patient is not permitted at this time. We ask for your support in following all these guidelines to ensure everyone's safety in our facilities. I want to offer as well my thanks to those of you who are following the public health measures in isolating and proceeding with testing and continuing on in this path with us over this next phase of the pandemic. I ask those others to please continue to keep your circle of contact small. And I want to wish everyone a safe new year as we turn the calendar into 2022 and forge ahead through the next weeks. Thank you.
Thank you very much, Marion. And I know for those who are tuned in online, in particular, those are friends in the media, that is a lot to digest. And so I'm sure you have many questions, and we'll do our best to answer as many of them as we can. But if you're not fully satisfied, then we can certainly provide some communications assistance after the briefing if you need more details. And we knew this is probably the most extensive briefing in terms of details, et cetera, that we've had for a while. So, but we'll do our best, and maybe we'll start with Jessica from CBC with some questions. Go ahead.
Okay, so first one is a clarification question. We have 3 people admitted to a hospital because of COVID, and 5 are in hospital for other reasons, meaning they got COVID while in hospital.
Thank you for the clarification. So the others who we mentioned who are in hospital may have been admitted for some other non-COVID reasons. So if this is not the reason, but if you fell and hurt your foot, and you happen to then have to be admitted to hospital, but you also had COVID, that you wouldn't be going because you needed to be treated for COVID. You were going for another reason. So that's that, or there was transmission in the hospital. So either those are the things that would be impacting those 5 that I mentioned, and there are 3 who are requiring treatment related to COVID in the hospital. Not every province is breaking it down like that, but I thought it's, when we're talking about severe outcomes related to COVID, at least at this point in time, we thought it's important to distinguish that at this stage, and so that people are aware of the impacts of the disease.
And the people in hospital right now, how are they doing? How would you characterize their health?
I mean, they're there because we've talked about the majority having mild to moderate illness, and so none of them are in the ICU. I think they're sick enough that they require medical care in hospital, and but none in the ICU.
How about healthcare staff? How many healthcare staff are currently off work affected by COVID-19?
And Marion, you may want to speak to that, because there are numbers that we have in terms of staff who are positive and staff who are close contacts with Health PI. But Marion, do you want to speak to that?
Sure, I can give a little estimate. We do know that in the last couple of weeks, we've had approximately 30 staff who have tested positive. But some of those would have recovered by now. We have approximately 20 staff currently following the work isolation protocols, being close contacts, but also have about 60 who've already completed that work isolation. So many people who have completed that phase already.
Contact tracing, so again, just to clarify, public health is no longer doing contact tracing of close contacts, is that correct?
Risk contacts. So if I had COVID and I got a call from public health nursing reviewing my isolation procedures and any questions, they'd say, you know, who do you live with? And make sure they know that they need to isolate as close contacts, and here's the information they need to know. But they will not call every member of my family. They would expect me to notify them, and also my if I had dinner with a friend last night, they would expect me to give that direction, and that there's actually some written material that is sent to the case to say, look, this is what you need to give to your close contacts. But if I was working in a long-term care facility, that's different. Then there'll be follow-up by public health to that facility for those high-risk settings, or if I worked in corrections, or if I worked in a shelter, or there'd be certain more vulnerable populations that they'll be doing there. So it's similar to other provinces, needing to really have islanders help us identify their close contacts wherever possible, but also knowing that public health is able to answer some questions, and now we have a 1-800 line as well, or using the 1-800 line that has been there. They will also support questions from people who are identified as close contacts or cases if they have any more questions. And we've updated some of the information on the website about cases and close contacts so that that can help, and information is being sent to cases to distribute, as well as there's information being printed and being given out to people at testing clinics so that they can have that and say, if I get a call that I'm positive, what am I supposed to do? Who am I supposed to contact? So hopefully it will help.
Responsible, if it's on an individual level, for their own contact tracing outside their immediate close contacts, and they should just know that if their case occurs kind of in isolation of, say, a workplace outbreak or something like that.
Yeah, so if you were at a gathering last night with 6 other people, you would tell the public health nurse, yes, I was there, and they'd say, look, this is the information you need to give them.
Okay.
They need to isolate, and they need to be tested, and this is when they need to be tested. So we're probably the last province to move to that, but given the high volume of cases, and we're looking for where we need to focus.
Okay.
And part of the reason we talked about adding some resources from within government to help answer some of the non-medical questions. I know there are lots of people who get a call and say they were with someone tested positive. So they're not a direct contact, but they have many, many questions. And so we're trying to take the burden off of public health and some of our nursing for those questions, just to answer some of the non-medical questions. Anything from a medical perspective, of course, we will try to make sure it gets to where it needs to be. But, you know, we've been very fortunate with a low case count that public health has been able to do the bulk of this. And that has not, as Dr. Morse, that hasn't been the norm across the country. I mean, it's because of our size and the low volume, we've been able to do that, and now we're not able to.
Okay. I just have a couple more questions.
Sure.
So at this point, with our high case count, why are you not bringing in further additional restrictions?
Well, I mean, I think we've spoken about that a little bit coming down. I don't know if you want to start, Premier.
I think a lot of people, perhaps when we announced a briefing today, were assuming that something more would be coming. I think in the past, when we've seen high case counts, we've implemented circuit breakers, for example. I think, we've been saying from the beginning of Omicron that, there's really no way to stop this dead in its tracks. We have to slow it down. Some of the measures that we have implemented are taking a little time to implement, but now we should start to see some of the benefits of that in the days ahead. We're looking at changing, just some minor things right now. I think we're maybe not prepared to talk about it fully, but, if you were, tongue piercings, for example, we will probably take a pause on that for a little while because of the direct impacts, of being in front of someone for a long time without a mask. But a lot of the measures that we have in place have been implemented to slow the spread of Omicron, and that's where we find ourselves now. So, we haven't gone down that other road yet. I mean, we're really trying to transition to living with this reality that we face here now, and just very hopeful that the case counts that we see, even though they're rising, the symptoms and illness haven't been serious yet. So, but I mean, we sort of evaluate this on a 24-hour basis. So, I mean, hopefully not, but, we reserve the right to change our mind here.
Yeah, I imagine people would be curious at this point what it would take to.
Yeah, Doctor, I think that's, well, I mean, I asked Dr. Morrison that every 3 times a day. I mean, and we've been conditioned here over the last 20 months or so to look at case counts, et cetera. And now, because because COVID-19 is changing, because there are variants popping up, it's forcing us to look at these things a little bit differently. I mean, this time last year, if we announced 169 cases, there would have been, we probably would have locked everybody in the house, quite seriously, because, but we didn't have the vaccination levels that we have now, and we don't know. We know much more about the, COVID in general. But like I say, I mean, we're trying to evolve with the virus. The virus is much more, much faster at this than we are, but we're trying our best to keep up. And we have perhaps, the strictest measures in the country right now. I mean, we require isolation coming into the province because we know the importation of the virus is still one of the main, reasons it spreads. So, but I think that's, Heather or Dr. Morrison, do you have anything to, yeah?
I mean, I'm glad you asked the question, and we certainly expected that. But I think it's a chance to reinforce the measures we do have. Working from home if you can, if you're able to do so, physical distancing. We know the virus and Omicron has a lot of viral particles that it produces, and but it doesn't weave away. It will come be more direct. So physical distancing is important, and certainly singing, shouting, laughing. You need even more physical distancing. And then we talk about the importance of masks and both people wearing the mask to protect the projection, if I have COVID, protect me from spreading the virus, but also you wearing a mask so that you don't breathe some of those particles in. So some of those things, we talk about the isolation, making sure you get tested if you have symptoms, that's small numbers. If we know that with Omicron, you're going to, if you're positive, transmit it to so many more people than you would have even with Delta, it speaks to the importance of limiting that spread. But yet, with all those things in place, how do we minimize the disruption to our society as well? And that's always that really tough balance, and it's not easy.
You bet. This one may be for Marion. You're moving to bigger clinics for vaccinations in 2 weeks from now, but for right now, do Islanders have enough access currently to booster appointments?
Well, we actually had some available appointments today at the clinic that was running in Charlottetown, which is why I wanted to mention that it was still available. And I know there were appointments tomorrow as well at that clinic, and it is going to be running every day over the weekend, including New Year's Day. So if you want to give yourself a New Year's gift, you do have some access for your booster doses at those clinics. And so we will be ramping up more. There were already a number of clinics scheduled for the new year, both for booster doses, but also I'll just remind everyone we will be expanding as well the clinics that were coming for children aged 5 to 11 who still need their first dose. So our public health clinics are also focused on that population as well. So we already had a number of clinics booked for next week, which will continue. And then we're looking to add on to those in addition.
Okay. And when children got their first doses, most were rebooked for their second dose 8 weeks later. Are parents able to book their children's second doses earlier than that and shorten that time between the doses?
That is not the recommendation to shorten that interval, and we know that the longer interval actually helps provide better protection overall, and we do want our children protected for into the spring and longer. So at this point, that is the National Advisory Committee recommendation, and so that's why it's been at 8 weeks at this point. The only other thing, just we were talking about third dose boosters, and for interest, 69% of Islanders who are over age 80 have received their third dose booster, and 27% of those eligible in their 70s have received their boosters, and 13% of those in their 60s.
Okay.
Dr. Morrison, you've told me a lot over the last couple of days, but there's 35,000 or so in the month of January of Islanders who would be scheduled. And it's our intention and hope that with the expansion of the offerings through pharmacies, with the mass clinics coming on stream, that we should be able to get close to being able to deliver that. It's a big undertaking, of course, but it's our goal to get as many of those completed in the month of January as we can. And just couldn't say enough about the pharmacies. I mean, they were doing about 1,500 to 1,800 vaccines a week, and now it looks like they're going to be able to double that for the most part. So all of that will help in getting us to get to the level we need. So.
What about the percentage breakdown of current active cases in terms of unvaccinated versus vaccinated?
I don't have that here. I mean, certainly we know that because of the high proportion of our population being vaccinated, we'll likely have more cases who are vaccinated. But I haven't asked Dr. Cameron, but usually that is updated on the website. I think we also will do the same breakdown for the hospital, because really we want to focus on the severe outcomes, and we'll start doing that for hospitalizations once we have a certain number in hospital, just to protect their privacy, and then we'll do it for how many people in hospital and how many people in ICU are vaccinated and not vaccinated.
Okay. Last question for me. How long is it taking right now for test results to come back on average?
Well, because we're doing almost all the testing at the clinics is by the ID Now molecular tests. The tests are back within a couple hours or maximum 4 hours. And the PCR tests, which I know people are aware of, there's a backlog. There was a backlog and there was a lab capacity there. But as of this morning, I think most of that backlog had been dealt with. So we're hoping that turnaround time for the PCR-based tests, for those who need the PCRs, will be much more back to normal within the day.
Okay. Thank you, all three.
Thank you, Jessica. Stu, do you have some questions?
I guess let's start with schools. I mean, we still don't know what's going on after January 10th or daycares, so wondering if you can address what happens after January 10th.
Perhaps we would use our next briefing to sort of, as we get closer to that, but it is certainly our intention to start with online learning, and that will get us through the first little bit of this. We all want to get the students back into the class as quickly as we can. Dr. Morrison has talked a little bit about, that will require us to provide some rapid tests to students and staff, et cetera, and to monitor that the best we can. I think it's our intention, it wouldn't be totally opposite of what Nova Scotia would be talking about, is trying to get students back into class in early to mid-January, as soon as we determine it's safe to do so and that we have the resources to monitor that. And then, I think Dr. Strang and Dr. Morrison mentioned this today, that Dr. Strang had a comment yesterday that we're measuring the mental health and the well-being of our students versus the variant here right now, and it's important that we measure that. So I don't think we'll be totally different than Nova Scotia. So we'll start with online learning. We know that isn't optimal, that isn't ideal. It's not the best for our students, and so our intention would be, when it's safe to do so, hopefully hopefully early to mid-January to get our students back in line, back in not online but in person, and hopefully we'll have our rapid test kits, et cetera, that we can distribute across the province and to try to have our schools operating as safely as possible. Did I miss?
I think we all know that there are harms for students for not being in class learning. So you're trying to balance that as well. But the things that will be in place when students do go back and staff do go back into the class will be, enhanced masking, cohorting, physical distancing where possible, enhanced cleaning, and testing. They'll allow, and also, the importance of ventilation in the schools. We've mentioned that as well. So those will all be things that we've started talking to education and the schools about. But I think that date isn't decided.
Yeah, for sure. Yep. Sorry. Yep.
Just, I guess, going off of Jessica's questions about further restrictions, I mean, any other time in this pandemic, we probably would have had more restrictions on restaurants, gyms, possibly even schools. So I heard vaccination levels as one reason as to why that's not happening right now. But wouldn't it make sense, I guess, to buy a little bit of time to, increase the booster dose level for more vulnerable populations if there were more restrictive public health measures put in place now rather than possibly later?
I think this is what we have certainly been considering and looking at, and also looking at what is working and what is being done elsewhere too. We do have our isolation measures in place. We know we have good testing access here in terms of our clinics and our availability there. So I think that those are important. And we've put the 50% capacity in our restaurants, emphasizing the distance between tables. And people, and trying to talk about some of those risks for people going to gyms, fitness facilities, and restaurants, and doing some of their own risk assessment too before they go into certain places. I think we're trying, as we make these steps, we talked about making these steps from a pandemic out of it, given the nature of the Omicron, its transmissibility, but also what we're learning. At this point in time, it does not seem to have the same severe outcomes. But the goal is to exactly that. Let's slow this transmission and do everything we can to slow the transmission. Try to get more boosters into those who need them, and yet try to not, I think what we learned in that first wave that we didn't really have here in the same way, but the first wave in the country, there are harms when there's a total lockdown, and we've tried to limit our circuit breakers to very short periods of time. So how do we do that and look after those who are most vulnerable? So it's sort of, as you said earlier, I think you're absolutely right. If there were at different points in the pandemic, we would have introduced slightly different measures, but we already have almost all these measures in place. Isolation, restrictions in visitation, we have restrictions in long-term care, we have restrictions in capacity in retail, we have restrictions in capacity in restaurants. We're having, mandatory masks and talking about the importance of masking and working at home. So we have a lot of the things that we've been doing throughout the pandemic, and it is our chance to really emphasize it. And of course, the small circle of contacts being really key.
Look, I'd only add to that is that for the large portion of this pandemic, we've been in the enviable position where we were, whether or not it was from Dr. Morrison and I at the top all the way down through Islanders, but we were kind of in the position and belief that zero case count was kind of our goal. And for the most part, we were able to deliver upon that because of the measures we had, the island being able to monitor who's coming in here and test them, et cetera. But, with Delta, the emergence of Delta first and now Omicron, zero is not a reasonable expectation anymore. And because of what we're seeing through the science and data that, and hoping like heck that it continues, that people, if they're turning positive, aren't getting really sick, that allows us to take a different approach. But as we have throughout COVID, if signals change, we will make more difficult decisions if they need to be made. But I know there are lots of islanders who might think that, we're already in a pretty significant lockdown as it is. I mean, we're online learning with our students in school and some of the other measures that Dr. Morrison talked about. But, we're trying to keep some type of semblance of normalcy rolling and learning to adapt to live with this. And that'll be our approach until the science changes. And if it does, then we'll have to adapt as well.
And some are asking, I know this may not be, this is not the question you asked you, but I mean, some are also asking, what are the indicators you will be looking at to ease the measures that for some feel they're too restrictive now, but they're the public health measures we have in place. And so that's where some of our work, is, and our thinking is too, because we do want to have children back to school. We want to have children and others doing other activities in the community and back to sport, back to recreational activities. But we want to do that when it's as safe as possible and we minimize that transmission, because if we get too many people sick, they will end up in hospital just by sheer numbers. So I know Dr. Cameron has been doing work with this and with the rest of the country too, looking at what will be our criteria and our signals for easing some of these measures. And because I think that's where every one of us want to get to as we transition out.
Okay. I guess just a question on rapid test supplies. So you've both talked about limits to rapid testing supplies. I guess I'm just wondering if you can tell me, I mean, obviously there's a preference for the use of the ID now Panbio molecular test, if I remember correctly, but the province has received, tens of thousands of tests of a different type, the Panbio test, BTNX. So are those supplies as limited as the ID now, or are we just sort of preferring to use one type in this province?
They all are finite in terms of how many we have. And what we have requested and have received word from Health Canada that we are expecting the shipment in January of additional of the rapid antigen take home. I mean, the difference is the molecular ID Now machine ones are not tests that you can take with you and take home, which are really, they have higher sensitivity, so they're good from that point of view, and that's why we want to do them at the clinic. But certainly a need to complement that, given the prevalence of COVID in our community with some of the antigen-based tests. So we'll have Health Canada delivering more in January, but we don't have a date yet about that delivery. And I think the Premier mentioned also trying to secure other antigen tests on top of that as well. So
how many rapid tests have been received, like at the moment, but haven't been deployed or used?
We have approximately 15 to 20,000 in our stockpile, and we're trying to reserve that for outbreaks, et cetera. One of the things that I don't know if we mentioned here, but we have been working, and it's online. I think I may have mentioned it last time about small and medium businesses also reaching out and getting access to some of the rapid tests, and we're helping provide that service until someone else can take that over in January as well. But so there have been rapid test kits delivered, for instance, to Health PI to help with the test to vaccinate, which is really important that we have tests available for that. We've used some for our schools and our sports teams when they need to be close contacts. We have them access PI. We're making sure they have as many as possible. We're making sure they have them at the points of entry for the repeat tests. So I think we have, I think maybe I can't remember, the days are running together, but at some point a couple weeks ago we had 80,000 and they've all been distributed, and I think there may be 15,000 left, and we need to have a little bit of a cushion there to get us through until we get more delivered in January.
I had a call the other night with Dominic LeBlanc, the Minister for Intergovernmental Affairs, and we talked a lot about the need for rapid tests and his commitment from the Prime Minister right on down that, they're working to secure a significant procurement. They realize the role that these rapid tests will play in getting us out of this. So every test that has been sent here, we have used or will allocate to be used, but we need more. That's why we're trying to get, we're trying to see if we can procure some of our own through different channels, and if we are, hopefully in January we'll be able to have 500,000 or 600,000 of these rapid tests, which they say our plan would be to distribute to students and families so we can test our students and teachers and staff on a regular basis to try to limit the impacts of the disease spreading through school if and when we get them back. So
we're, it sort of seems the prioritization right now is frontline health workers. Does that include long-term care, like a congregate? Yep. Okay. Yep. And so as of now, that's the priority. Once the shipment is received, what you're saying is that another priority is students, parents within the school system. Absolutely. Do I understand that correctly?
Yes, but I think I really haven't put them as one priority or the other. I mean, when we laid out, I don't, off the top of my head, we had some for access PI for those who didn't have access to the testing clinic, especially in our remoter parts of the province. So there was making sure they had them, as well as our points of entry, and as well for our test or vaccinate group, and as well as the test to stay groups, and that would, as you said, long-term care, community care, health PI, and again, so we're just trying to make sure they all get used, and want them to remembering that. And I think I've said it before, but it's probably worth saying again. So if you use a rapid antigen test, and we talked about the sensitivities and specificities of the different tests that are influenced by a number of factors, but if you use a rapid antigen test and you test positive, you need to assume you're positive and then go get it confirmed at a testing clinic. But if a negative test, it's not a hallway pass to go out to a party and or go do something, because it just doesn't have the same diagnostic sensitivity that we would like in some of the other tests.
I guess just a last thing. I mean, it is a criticism that has been coming from the opposition parties, I guess, about rapid testing availability. We're 20, I don't remember how many months into this pandemic. Why is it we sort of continue to face sort of supply and distribution challenges with rapid tests?
I think that's probably a question better asked for the federal government, who are procuring these rapid test kits on behalf of all provinces. I mean, I think we've had a significant allotment that we have distributed, but they're certainly in greater demand now, and I think they're part of the immediate to mid-term solution, I guess, or way out of this. So I also think that probably prior to 18 months ago, there probably wasn't much need for rapid kits for COVID, and I think that the people who make these kits around the world are probably making them at an incredible pace, but there's a growing need for them everywhere in the world. So I don't know if it's a supply chain thing or not, but I'm grateful for the federal government response in general. And in terms of the procurement, there's been some challenging days at the beginning with PPE and other things, but I think the procurement from the federal government has served us quite well here, and we'll need to continue to do so. But
all the ID Now machines and tests that we've been using for months at our points of entry, which have helped us not have the same measures in many ways in this province, have all been a result of that federal procurement. And they're considered rapid tests, but they're not the take-home tests. So really, I think they've all served a very important role here, and will continue to do that and as we adjust.
Good, Stu. John, do you have some questions, or?
How many ICU beds do we have?
Marion, do you want to take that one?
Yes, I can. We have in our plan to ramp up to 20 if necessary, and that would be our maximum in our plans at this point in time. But in normal operations, we have around 6 beds at Prince County Hospital in their ICU and 8 at the QEH. So the ramp up to 20 is beyond that, of course, in our planning.
Thank you.
Okay. We can go to some of our friends online. I don't know who's there and if they're still waiting, but we'll open up to questions from the online journalists.
Brittany Spencer, CBC.
Hi, everyone. Can you hear me okay?
Ken.
All right, wonderful. So I just wanted to clarify, sort of following on one of Stu's questions. So it's about schools. So is the plan at this point to reopen on January 10th?
I don't think we're committed to a date as of yet. We're going to begin with the online learning component that we have talked about, and that's what they're working toward. Nova Scotia has announced January 10th, and as I say, it's our intention, like Nova Scotia, to try to get students back into in-person learning as quickly as we can when it's safe to do so. We're hoping for early January. We haven't committed to a date yet, but we'll probably do more of these briefings a little bit more regular over the next week or so, and we'll certainly have more information on that, but we're not prepared yet to commit to a date for in-person classes.
Okay. My next question is about daycare, and more specifically about why they aren't closing next week like schools and post-secondary institutions. And I'm wondering what assurances you can offer, maybe Dr. Morrison, you can answer this, that it's safe for parents to be sending their children to daycare.
I know there have been different questions about daycares, and I know from an earlier meeting this morning and yesterday, they're going to be setting up a meeting with some people from our office and the early learning sector. So I guess early learning has operated and it has been open like a frontline service throughout the pandemic. And they are, doing smaller numbers. They're doing great screening of children. We have provided some test kits as well to some of the early learning centers and would like to provide more. They are doing the enhanced cleaning. So they are... It's a group that I know has been impacted by COVID-19, like many of our frontline services. The numbers have tended to be smaller in many of these centers, and also when we look at the disease in those and the transmission in these environments, I think it's a challenge because we know so many parents rely on those early learning childcare facilities for their ability to actually go to work as well. And we recognize that the staff who are working in these centers have questions, and they have been really amazing. And we've been trying to, continue to provide the best advice we can in terms of creating a safe environment. There's no environment that we can go into that is 100%, but I think we are trying to minimize illness of any kind, really, in that setting, and that's why trying to make sure children don't go when they're feeling ill is really important. And obviously, if a young child is isolating with someone who's a close contact, they can't go, and if they're isolating with someone who's a case, they can't go to daycare.
No, that's great. Yeah.
Felix Arsenault, Radio-Canada.
Oui, est-ce que vous pouvez bien m'entendre?
Oui.
Yep.
Parfait. j'aimerais poser quelques questions en français, là, si possible. Il y en a quelques-uns qui ont déjà été répondus en anglais. Mais pourquoi est-ce qu'on ne met pas en place plus de restrictions avec les records de cas qu'on voit dans les derniers jours?
Ah oui, c'est une bonne question. Et puis, c'est vraiment parce qu'on est en train de changer un peu à cause de l'évidence qu'on a à propos de Omicron. On veut vraiment on a beaucoup de mesures en place déjà. Il faut rester chez vous, rester chez vous pour travailler si possible. Il faut avoir la distance physique entre les autres membres hors de la famille. Il faut garder les masques qui sont qui sont bons, les bons masques et sont portés proprement. Il faut, on a l'isolement quand vous arrivez à l'île du Prince-Édouard. Et on veut que c'est seulement 50% capacité au resto, au magasin. Alors, on a beaucoup de mesures en place et on essaie de faire la balance vraiment de la transmission et les plus de cas avec minimiser. On sait qu'il y a aussi des impacts sur les gens si on ferme tout. Et on sait depuis la première vague que on a fait beaucoup d'impact en faisant ça. Alors, j'espère qu'on peut... si on a besoin, on va changer, mais j'espère qu'on peut garder les mesures, que les personnes gardent la cercle des contacts très, très petits et puis que ça va pas prévenir la COVID, mais ça va ralentir la transmission.
Question peut-être du côté du nombre d'hospitalisations. Ça faisait longtemps qu'on n'a pas vu de cas hospitalisés à l'île du Prince-Édouard. Est-ce que ça vous inquiète, le nombre qui grandit d'hospitalisations?
Oui, bien sûr. On a 3 personnes à l'hôpital et puis j'espère qu'ils vont améliorer, bien sûr. Et je suis... ça m'inquiète, ça me décourage. Et c'est pour cette raison qu'on tous les insulaires doivent travailler ensemble pour diminuer le nombre de cas pour essayer de prévenir les personnes à l'hôpital. Et puis pour moi, ça aussi, c'est important que tout le monde reçoive leur vaccin et le booster.
Et une dernière question du côté du retour en classe. Vous l'avez mentionné en anglais, mais c'est quoi le plan pour l'instant pour le retour en classe?
On n'a pas vraiment une date. On va commencer avec sur online. Et puis, quand on retourne à l'école, on va avoir les masques, les cohortes. Faut pas venir à l'école si vous êtes malade. On va aussi avoir les tests avant de retourner à l'école et j'espère avoir les tests qui continuent à part de ça pour diminuer un peu le risque. Alors, on commence à en parler, mais le premier ministre a mentionné, on va continuer à en parler, puis établir une date un peu plus proche du 10 janvier.
Parfait, merci beaucoup, c'est apprécié.
Okay, merci.
Well, I think that is all. Sorry, Jessica.
Okay.
You?
Sorry, I think Brittany got cut off. This is a very
Oh, sorry.
Okay.
Does the test to stay strategy apply to daycare staff?
Actually, I think it would, yes. Now, I haven't, again, we're just trying to get this up and running, so I haven't been approached particularly by, but if it was related to outbreak of staff, we would definitely look at it. So hopefully we'll figure out a better way of making sure that those requests get, we can look at those requests and make sure they have access to the testing they need. So because that's part of it.
So the individual center would probably have to make that application to CPHO. Okay, thank you.
Exactly. And we might be involved if there was an outbreak at that center, so that we'd already be involved.
Okay, thank you.
Thank you to all. And so to Marion and Dr. Morrison and all of our friends in the media here, Happy New Year to all Islanders. It's be a little bit different again this year, but all the best, and let's hope and pray for a better 2022. But Happy New Year.